All right. Good afternoon, everyone. Welcome to the Nair Outreach Center. Thank you all for joining us today to help us launch the Charitable Pharmacy's Prescribing Hope campaign. For those of you who have not had the opportunity to meet, my name is Mike Dunn. I'm Executive Director at St. Vincent de Paul. Kelly, grab a seat. And I'm Executive Director of St. Vincent de Paul here in Cincinnati. I remember back in 2015 when I was interviewing for the Executive Director position. The hiring committee mentioned to me one of the largest assistance programs that St. Vincent de Paul has is a charitable pharmacy. I have to be honest, my mind began to race. What in the world is a charitable pharmacy? And how exactly does it work? I had all sorts of concepts in my head. Well, since 2015, I've been blessed with the opportunity to witness the operation of essentially what is a small miracle that happens here each and every day. In 2006, then Executive Director Liz Carter and some of her Leadership Cincinnati classmates, along with recently hired Director of Pharmacy Mike Espel, helped get the law changed in the state of Ohio to be able to receive drug samples from medical offices. Mike is here somewhere. There's Mike. If we can give Mike a round of applause. Thank you. The plan then was to serve neighbors who had no insurance. During that first year of operation, the charitable pharmacy dispensed just over 7,000 free prescriptions. Fast forward to this past fiscal year. The charitable pharmacy dispensed over 70,000 free prescriptions, valued at over $10.5 million. While doing this, the pharmacy also offered innovative clinical programs, including the services of a nurse practitioner, to help improve neighbors' health outcomes and prevent $5.4 million of healthcare costs to the greater healthcare community. The pharmacy did this by procuring and dispensing 87% of their medications from donated sources while engaging over 200 volunteers. Since opening the pharmacy, we have dispensed more than 710,000 free prescriptions valued over $95 million. It's amazing how that seed planted in 2006 in that Leadership Cincinnati class has grown to such abundance. And I know Ron Christian, who is sitting in the room, was part of that Leadership Cincinnati class. And Ron was very instrumental in helping the organization through the change of law. So Ron, thank you as well. In the spring of 2021, Dr. Rusty Currington became the director of the pharmacy as Mike Espel retired. Rusty was charged with creating a new strategic plan for the pharmacy, which he, with the support and guidance of our pharmacy board, accomplished. The new ambitious, and it's very ambitious, the new ambitious 3-year plan went into effect this past October 1st. The charitable pharmacy is somewhat of a hidden gem in our community, but more and more people are becoming aware of it and seeking our services. We need to be able to expand access to our charitable pharmacy and meet this ever-increasing demand. The new strategic plan puts us on the course to meet that demand, but it will obviously take additional resources to be able to execute that plan. To talk about the Prescribing Hope campaign, which will help us raise those resources, I'm going to introduce E.W. Scripps CFO and our campaign chairperson, Jason Combs. I want to thank you all for being here today, and thank you for how each of you support the charitable pharmacy in your own way.
Jason. Good afternoon, everybody. As Mike said, I'm Jason Combs. I have the honor and privilege of both sitting on the board for the Charter Pharmacy, but also being the chairperson for the Prescribing campaign. So it was back on October 1st where we kicked off what we're calling the silent phase of this campaign. And we set out with the goal to raise $5 million. And I'm extremely happy and pleased to announce that we've reached nearly $3.2 million already in gifts and pledges. So really great progress, and I want to thank each and every one of you who have already contributed to our campaign. Your generosity is truly inspiring to myself and everybody else who's up here. I particularly want to recognize our lead donors thus far. Those are the Farmer Family Foundation, the Carol Ann and Ralph B. Hale Jr. U.S. Bank Foundation, Don Nyer, Carl and Linda de Blasio, Harold and the Harold C. Schott Foundation, and Florence Ketters. Please join me in a round of applause for all of those donors. I'd also like to take the opportunity to thank my fellow campaign committee members, many of whom I see here today. They include Jenny Berg, Ron Christian, Bill Coleman, Susan Cranley, Kelly Dehan, Will Broneman, Dan Hurley, Dr. Mike Jennings, Robert Killens Jr., Kitty Strauss-Rosenthal, Todd Shavs, and Father Barry Lindholz. Please join me in a round of applause for these committee members as well. While we have made great progress, as I just talked about, more work certainly needs to be done to ensure that our neighbors, staff, and our volunteers receive the resources necessary to be successful. If you've not already done so, I would please ask you to consider joining us in helping change the lives of countless Cincinnati neighbors by making your pledge to the Prescribing campaign. As part of today's event, we're going to provide you with a glimpse of the impact that this campaign will have on the neighbors that we serve. More so than anything that this campaign accomplishes in terms of dollars raised, the measure of how successful our collective work will be is how we will impact our neighbors' lives. So with that in mind, I'm going to turn it over in just a second to our Pharmacy Operations Manager, Dr. Lydia Bailey, who will share her insights on serving our neighbors in need. But first, I wanted to reiterate what Mike said, and thank you all again for your support, and thank you so much for being here today.
Thanks, Todd. So my name is Lydia Bailey, and I am a proud pharmacist here at St. Vincent de Paul. And if you've been around this organization for more than like a day, you know how special this place really is. I think it's the right mixture of passionate people and divine intervention. I saw that first when I came in 2015 in my residency interview, and I left that day seeing a different way to be a pharmacist. It was a way that placed patients above how much money you make. It was a way that put patients and their health care in front of meetings or deadlines. It engaged employees and volunteers to stay here for 10 plus years. And I started meeting board members that actually cared about the work that they were doing. Once I started practicing here, I met the most amazing patients. And it was people who started to trust me with their health care, and they started to trust me that I would give them the medications they needed every single month. And that was what got my attention, because the longer I was here, the more I became aware of our inventory. I saw the days where the insulin wasn't in the refrigerator. And I saw the times where they didn't have certain pills on the shelves, or maybe we couldn't purchase that inhaler that we really needed. I learned that 66% of hospital readmissions are related to medications and medication access. So maybe it's patients not being able to afford the medications they're prescribed, maybe they stretch doses because they can't afford the full amount, or maybe they just don't know how to use it. And so I learned that medication access, consistent medication access, is really important and it really matters. And I started seeing firsthand that St. Vincent de Paul handles medication access really well. So we have a patient here that'll share a story in just a moment, and his story really highlights what happens when you have consistent access to your medications. And his story really echoes hundreds of other neighbors that we serve. We serve over 700 patients a month, and I would say almost all of their stories sound like what you're going to hear tonight. But to be honest, not every single story is going to sound like this. We have some bad stories too. A week ago, I sent away a patient wheezing from this counter without the inhaler that he needed because we didn't have it. A month ago, I sent away a patient who knew she was at a higher risk for heart attack and stroke because we had no blood thinners left to give her, and she left scared. So these are the stories that tell us that we're not done yet. The work is still here. We still have things to do. Medication access is important everywhere, but it is everything for us at St. Vincent de Paul because we're the last resort. By the time we send someone away empty-handed, they have nowhere else to get it. We are the Hail Marys. But this campaign helps us not have to turn away patients. This campaign is the sustainability that we need so that our inventory never has to run out of the life-saving medications. It lets us be the pharmacists and the board members and the donors and the volunteers that we came here to be. So thank you for taking interest in this special place. And I really pray that you know how special and how needed you are and part of this organization. So please join me in welcoming up Mr. Jeffrey Jenkins to share his story.
Hello, how y'all doing? I'm gonna try to make this as quick as possible. Although interesting, I'm gonna try to make it quick. I became a diabetic when I was 41 years old in 2001. And at that time I told the doctor, there's no way I'm God's blue green herb, I'm shooting anything, you can forget it. So they put me on metformin and glucophage after they found out I had a 1,270 sugar. She said he didn't even know how I walked in the hospital. Metformin and glucophage stopped working after 3 months, and I'm back in the hospital, 1,100 sugar count, and I'm on 6 bottles of insulin a month, every single month. Since then, fast forward 2009, I come back here. 2 years later, I ended up at St. Vincent de Paul's Pharmacy. But in that effort, I have osteoarthritis in my knee, vasculitis in my legs, bad back, had a stroke in 2012. This is 4 toes, 2 on the left, 2 on the right. Fortunately, I haven't been cut on since 2018, but the help with the food pantry and being able to change my eating habits, I've been able to stop being cut on. I also had a stent in my chest in February 21, stent in my left leg March 21, balloon in my right leg April 21, and I had a 10 centimeters lateral cut on October 19. And at Berkeley, I'm diabetic, high blood pressure, and high cholesterol with a lot of complications. I take 18 pills a day, 11 blood pressure pills, and without them, I will shoot up to 200 and something, over 100 and something, to have another stroke. Fortunately, I changed my eating habits, and everything wasn't getting better. Repeated remarks from Mark, oh, you gotta get your A1C down, you gotta get it below 8. I told him, I said, I'm a severe diabetic, that will never happen. We fought around about it for years. And there was no way I thought I was gonna be able to do that. But with the help of medicine, and with the 18 pills a day, 11 of them blood pressure pills, I didn't mention the 150 units of insulin, 30 shots twice a day. 30 shots, 30 meds, 5 times a day, 150 units of insulin. I lost 26 pounds. Fortunately, I got that down to around 100, and my blood pressure is now 126/78. And that's only recently after losing 26 pounds, because my normal blood pressure used to be 170/90 every single day. But with the help of the pharmacy assistants, the food pantry, my doctor, and changing everything is much better controlled. In the last 7 readings of my A1C, that have been between 6.6 and 7.3. Because I was in the hospital 20 times a year with headaches, high blood pressure, chest pain. I was either on nitroglycerin tablets and isosorb, and I've been able to cut those out. And I've been able to reduce 2 blood pressure medications after losing weight. But it has been a journey, and it's been hard, and they're still working with me after 15 years. And I wouldn't even be alive without it. You know, I'm on Social Security, but it doesn't pay for the medication. So there's no way I would have been able to get it at all. And then, with me paying child support is considered a loss of income. I can't get food stamps, I can't get hood, Section 8, that out, nothing. So if it wasn't for the food pantry, I wouldn't be able to eat right to be able to take care of myself while I was getting the medicine as a pharmacist. So inadvertently, this has been a really, really great thing for me. And I tell everybody I can, look, go register at the pharmacy on Bank Street. They'll give you your medicine. I've told 100 people, it surprised me how many people still don't know about it. I mean, not because they're not trying to get it out, because people don't take the time to find out the information. So with that being said, I still appreciate them every day. Before I leave this desk, I say thank you very much. I appreciate y'all, because y'all didn't have to be here, and I love y'all to death for it. I let them know how much they appreciate it every time I leave this place. So thank you very much. Thank you, Mark, for staying on my back and finding me what I can get. So with that being said, I appreciate y'all. Thanks for listening to me, and God bless.
I've known Mr. Jenkins for years, and who he is today is just a testament of the community, the support, but truly all the hard work that he's done. What a great testimony. Thank you. My name is Rusty Currington. I'm the Director of Pharmacy for St. Vincent de Paul Charitable Pharmacy. I came here as a volunteer in 2008, 2 years after we opened, and it's truly the investment of this community, of you and those, the people here training students like I was back in the day, and young staff members and residents, and just investing in some product of the organization, and it's a privilege to be leading this organization now. The vision for the for the Prescribing Hope campaign has been 14 years in the making. As I said, I was in 2008, I began volunteering, and it was at that time, the first time I heard a patient come up to the counter and tell the pharmacist there, "You just saved my life." And hearing those words, it impacts you very, very deeply. As a volunteer pharmacy technician, I became a member of a team that saves lives. Someone who could not pay for their life-saving medication received exactly what they needed. They came desperate for help and received it. Someone was hopeless, and I got to be a part of a community that prescribes hope to those who need it. So what do you do whenever you've been a part, whenever you've seen someone save a life and you got to have any part in that? What do you do? Well, many of you here already know. Those words, "you saved my life," become fuel that drive you to help more people who need hope. Now, what happens when you hear hundreds of people, as my staff can testify, what happens when you hear hundreds of people say, "You saved my life"? These words light a fire that becomes a passion that to provide hope to those who need it. And you can see this passion in our volunteers, our staff, our partners, and our donors. Many are present today. Now, what do you do when you've heard thousands of people say, "You saved my life"? Well, from my personal experience, just stand before a group of people and ask them for $5 million to do it some more. Because after 1,000 comes tens of thousands. We're here to save lives. You're a part of that. I often joke that giving away free medications is not a good business plan. There's no charge. We don't bill insurance. We don't take payment of any kind. Yet the charitable pharmacy has existed for over 16 years doing just that, because it's the community support. It's those of you who come, who give generously, give time and resources to make sure this is possible. It's because of you, our community, who volunteers their time and medical expertise to care for our patients. It's because of you, our partners, who donate prescription medication to ensure our shelves are never empty. And it's because of you, our donors, who make it possible to serve the next patient, and the next patient, and the next, and the next. You make it possible for us to prescribe hope on a daily basis. You make it possible for people like me to dream big, to look into the future, and ask, how can we impact the community for the greater good? On behalf of the Society of St. Vincent de Paul and our neighbors in need, I want to say thank you. Thank you for prescribing hope to our community. Saving lives today and the years to come is just what the Prescribing Hope campaign is all about. In 2006, we opened up the first charitable pharmacy in Southwest Ohio. In 2016, we built the second charitable pharmacy in Hamilton County. The first of its kind to be located inside of a thrift store, where we know the working poor came to shop and just live their daily lives, come to access a charitable pharmacy. And in 2023, we are excited to announce we will construct and open our third location, this time inside of our Milford thrift store in Claremont County. Not only will this location expand medication access to residents of Claremont County, we also see this as a bridge to help Brown, Adams, Clinton, and Highland County, making our service area now 8 counties, doubling our current capacity. Funds from the Prescribing Hope campaign will provide unprecedented access to charitable pharmacy services across Southwest Ohio. Additionally, this campaign will broaden our services as well. Each year, we make intentional efforts to talk with our patients and listen to their needs. Our patient surveys are a conversation. It's not just a few questions. Tell us what you need and how can we address those needs. And from these conversations, we know that our Western Hills Pharmacy, located about 10 minutes on the west side from here, we know that they needed more hours, that we need to be open more. And so we listened and we're responding through the Prescribing Hope campaign. Our neighbors without a primary care physician need access to our on-site nurse practitioner and lab services. We listened, and that's what the Prescribing Hope campaign will help us to do. Our uninsured neighbors need access to our on-site insurance navigator so they can build a path out of the safety net while also learning from our clinical pharmacy team how they can reach their health goals. That's what the Prescribing Hope campaign is all about. Overwhelmingly, though, our patients and our community need to know that the charitable pharmacy will exist in the future. It's been 16 years, and we hope 17, 18, and decades down the line, we can say the millions of people that we've impacted. When someone's turned away from a local pharmacy because of their inability to pay, they need to know that St. Vincent de Paul Charitable Pharmacy is accepting new patients. When someone's leaving one of our 4 hospital systems in the area, after staying overnight with an emergency room visit, they need to know they can receive immediate access at the charitable pharmacy. When someone's diagnosed with diabetes or heart disease, they need to know that their community has a resource that will fill their medications month after month after month and not give up on them. Over the past year, our community has already raised $3.2 million in support of this campaign, but we need your help to fully fund this vision. So will you join us? Will you join us as we expand access? Will you join us as we broaden our services? Will you join us as we take our next steps toward hearing that tens of thousands say, "You've saved my life"? Many still come to us having lost all hope, and will you join us? Together, we will prescribe hope to those who need it. Thank you, and God bless.
So when I mentioned that a small miracle happens here on a daily basis, it was not hyperbole, it was not an exaggeration. Again, when you go back to 2006, just the thought of creating this, what a kind of out-of-the-box crazy idea. Here we are, all these years later, and we're about to open a 3rd location. It's because of a lot of people in this room, again, Mike Estill, Rusty Currington, Lydia Bailey, most of the pharmacy staff is over there. These folks make it happen every day, and it's our job to provide them with the resources necessary to be successful. So, please join us. If you have any questions about the campaign, I'm around, Rusty's around, Jason's around. There's plenty of food and drink for you all, but most importantly, we want to give you a glimpse behind the curtain. So we are going to be doing tours of the pharmacy. If you are interested in taking a tour, meet in this hallway in a couple minutes. It won't take all that long, but again, we want to expose you to the day-to-day workings of the charitable pharmacy so you see how it is this all happens. Because if you're like me when I started, how does this happen here at St. Vincent de Paul? We'll show you. We'll explain it to you. And we'd love for you to have that opportunity. So again, thanks for being here today. Again, enjoy your time, grab some food, and please take advantage of the tours. and help us prescribe hope to many more neighbors. Thank you.